Good afternoon and welcome to Cancer Conversations. This is a program brought to you by UNC Lineberger's Comprehensive Cancer Center. And today we're going to be talking about getting started with exercise. I wanted to call your attention to the number on your screen. If you're having any audio or visual problems, please call 919-445-1000 and we'll help you. I also want to bring your attention to the email address on your screen. That is going to be for any questions you have for the presenter. That will pop up on our end and we'll answer those questions at the end of the webinar. Today's speaker is DJ Amatuli. He is a senior trainer with UNC's Get Real and Heal program. He's also a master's candidate for our exercise physiology program. He's going to be talking about getting started with exercise. So again, please look for the email address on the bottom of your screen and we'll answer your questions at the end. But without further ado, I'll turn it over to DJ.
All right. Hey everybody. So today we're going to talk about some basic things that can help you get started with exercise, and we'll talk about why exercise is important, some of the benefits of exercising, and then really importantly some things to consider when you are getting started with exercise, whether it's working with a trainer or doing it by yourself. Finally, we'll kind of break the exercise down into 4 categories that we call the FIT principle. And FIT stands for frequency, intensity, time, and type. But we'll go through those individually and I'll walk you through it. Okay? So first thing is, why is exercise important? Well, it's important for everyone, but especially following a cancer diagnosis, we've seen that not being active is one of the key factors in cancer recurrences. So if we can get people moving, even if it's just moderate or light exercise, we can decrease that chance of recurrence by quite a bit. And some research shows that 20% of cancer diagnoses can be connected to lack of activity and other lifestyle factors linked to not being active. So when we talk about exercise, I want it to not be too intimidating where you have to think about going to a gym and, sweating hard for an hour. We just need you to think of it as getting up, moving, breaking up those bouts of prolonged sitting throughout your day, and just trying to add a little bit more movement to your life. So one of the things that's a risk factor for cancer is excess weight. And exercise, along with diet, can help control your weight and help to mitigate that risk a little bit. It can also protect against diabetes, heart and vascular disease, and even boost your immune system. So now we're in this state with cancer where most people are actually surviving cancer. In fact, for breast cancer, there's a 90% survival rate for 5 years. But the problem with that is so many people, as they're living with this cancer diagnosis, are developing other diseases that are usually heart and vascular related because of their treatment or because of the pain and fatigue that they have from the treatment. They don't really feel like getting up and moving, so then all these things start to become a problem, and we need to see if we can get people to start adding a little bit of exercise back into their life, even if it's just going for a walk every morning. The other thing is, following cancer, a lot of times there'll be some immune system issues, and getting the right amount of exercise can help boost your immune system. If you do too much, it could actually hurt you, but if you do some light to moderate exercise, it can actually help boost your immune system and help you fight disease. And then on top of that, not even cancer related, exercise can decrease all causes of death up to 15%. So if you do moderate exercise 3 days a week, you can decrease your all-chance mortality by 15%. So another part about exercise is that there was an expert panel on cancer research that said there's ample evidence that exercise is safe both during and after treatment for all types of cancer reviewed. There is some more evidence showing positive benefits specifically with breast cancer, but the good news is that you will rarely find a doctor that's going to tell you not to exercise following your cancer treatment. You are safe to exercise during the treatment as well, but I think it's important to keep yourself in a state where you're just feeling like you can keep your energy level up And sometimes exercising during treatment, if you do too much, can actually make you more fatigued. So you kind of have to find a balance, try and keep up with your activities of daily living, but not overdo it. And then once you're through your treatment, that's when you can start to ramp up the intensity of your exercise a little bit more. So some of the benefits of exercise are you'll improve your endurance, improve your strength, your flexibility, your quality of life, and even your mental health. So when we talk about endurance, we think of it as a way of how long can you sustain an activity. So sometimes it's easier to think about it in terms of walking or running. So how long can you walk or run without getting tired? And then strength is geared a little bit more towards how much can your muscles do? Do you have trouble getting in and out of a chair? Do you have trouble lifting things over your head and putting them on a shelf? Flexibility is going to be how much your muscles can stretch without hurting. So are you able to touch your toes? If you've gone through surgery for breast cancer, are you able to get your arm over your head? And not only are you able to get it over your head, but can you do it correctly and without pain? I'm going to skip down to mental health for a second. Exercise is also shown to improve mental health, so it can decrease depression and anxiety and in a whole host of other things. But I want to focus on quality of life for a second, because to me and what I've seen doing this for the past 10 years, the quality of life is where we see the most improvement. So exercise itself is great physiologically. It's, like I said, it's great for your immune system. It's good for your heart. It's good for your muscles. But I think the one thing that people are searching for following a cancer treatment is improved quality of life. They want to be able to do their activities of daily living, spend time with their family, and just feel like they're able to do all the things that they were before their cancer. So quality of life is also a great one because it doesn't take intense exercise to get that back. It's just sort of getting that feeling of control back. And that can be through feeling a sense of control when you're able to go out for a walk by yourself and not feel like you're at risk for anything. Okay, so we'll talk about that a little bit more as we go on. Okay, important things to consider. While you will never have a doctor tell you that you shouldn't exercise, it is still very important that you talk to your doctor before you exercise, because most exercise programs that you go to, including ours at Get Real and Heal, we are going to need medical clearance from your doctor. And some of the things they take into consideration are, especially depending on the kind of treatment you have, if there were any cardiomyopathies, which is essentially when you have a cancer treatment that tends to affect your heart. They just want to make sure that your heart is okay for exercise. And even if it's not, you still will exercise, but we're just going to start you at a lower level and build you up a little bit more slowly. Okay? So make sure that you get medical clearance from your doctor before you go to exercise, whether you're going with a trainer or if you're going to be by yourself. When you do meet with a trainer, you're going to go over your medical history. So they're going to include things like side effects and any limitations you might be feeling. And make sure when you're filling out a medical history that you're not only including some of the things that had to do with your cancer treatment, but anything else that might hinder you for exercise. So we're thinking if you have arthritis and maybe you might have some knee issues or some lower back issues, your trainer needs to know these things, because the more they know, the better they can help you. And they can also keep you from getting hurt. So make sure you fill out those medical histories as in-depth as you can. One other document you see a lot is a PARQ. So a PARQ stands for a Physical Activity Readiness Questionnaire. It's 7 yes or no questions, which I'll show you on the next slide. And it's really just asking about, it's 7 situations about exercise and if you've ever had any issues with it. So I'll show you here. So some of them are, has your doctor ever said that you have a heart condition and that you should only do physical activity recommended by a doctor? Do you feel pain in your chest when you do physical activity? We also ask, do you lose your balance because of dizziness, or have you ever lost consciousness? And things like, do you know of any other reason why you should not do physical activity? Again, all these things do is help your trainer get a good idea of what to expect as you go into working with them. Okay, So when you meet your trainer, and this is important to remember because there are not a lot of trainers out there that have worked specifically with the cancer population. So if you were to come to our program, you would have trainers that have been trained in how to deal with the side effects from cancer treatment, but that's not going to be the case if you go to just a corporate gym. So it is important that you talk and be open with your trainer. Make sure they know exactly how you're feeling all the time. Every day when you go into exercise, they need to know, did you sleep enough last night? Are you feeling fatigued? Do you have any pain? What things do we need to avoid for that day? And please do not be afraid to speak up if you're uncomfortable. Your trainer's only going to know what you tell them, so it's important that you tell them if there's an exercise that bothers you, or even before you do an exercise if you have a feeling that it's not going to be good for you. A good trainer will know how to vary that exercise so that it's healthy and safe and effective for you. Whether you're working with a trainer or by yourself, you really want to start very slowly, okay? On top of that, you want to progress slowly as well. So if you start out too fast, that's a good way to get hurt. So you want to pull back a little bit, start slower than you may even think that you should, and then you can progress as time goes on. But you say you're lifting a weight, you want to start with a light weight, build up slowly over time, okay? If you're going for a walk, maybe start with a 10-minute walk, and then as the weeks go on, you can build up to 15, 20, 25, and eventually we're trying to get to 30 minutes. Some other things to consider is that exercise is not one size fits all, and that's between and within cancer groups. So whether you're a cancer survivor or patient or a non-cancer patient, exercise is not going to be the same for every person, and even between two different cancer survivors, exercise is not going to affect them the same way. So it's important to know your limitations, try not to overdo it, and remember that just a little bit goes a long way. So even if you start with just parking at the back of a parking lot and walking to the store, and that's your exercise for the day, that's okay, and you should be happy with that. And I think it's also important when you're going out into the world to start exercise that maybe a group exercise class isn't the best way to start, because everyone in that class is going to be treated the same way, and that might not be right for you. So it might be better to start on a one-on-one basis, or even doing stuff on your own to see how you feel and how you react to things. And then as you start to get a little bit stronger, then you can start joining some of those classes. Or there are some cancer-specific group classes out there. So in our area here, we have yoga for cancer survivors. So look for things like that in your area too that cater to a cancer population, because those trainers are going to know better how to deal with some of those issues. Okay. You want to find something that you like. You're never going to be able to keep up with exercise unless you're doing something fun. One of the reasons most people stop exercising is because they're not having fun with it. So usually if you hit about that 2-week mark and you're still doing it, then you're starting to form a habit. But if you go to 3 exercise sessions and you just hate it, it's a good chance you're not going to stick with it. So you can be creative. You can go for a walk, go for a hike. You can try swimming, but I would recommend not swimming right after treatment. Your doctor would probably tell you the same thing. You just want to wait till your immune system gets a little bit better. But find something fun. You can go to dance classes, anything like that. It doesn't have to be your stereotypical form of exercise in a gym. It just needs to be moving and fun, something that gets your heart rate up, gets you breathing a little bit harder than normal. One thing I always tell people also is to schedule exercise into your day. Try to make time as opposed to find time. If you schedule that exercise every day, like right before you eat lunch, even if you're working, then you have it in your day, it's set there, you know that you're going to do it, and you don't have to try and scramble to find time at the end of the day, okay? So now we'll get a little bit into the FIT principle, and we'll break it down into its components. So as I said at the beginning, F stands for frequency. So this is how many times a week you're going to do it. Intensity is I, and that's just how hard the exercise is. And then there's time. That's going to be how long each exercise session is. And then type, and that's just the kind of exercise you choose to do. So For frequency, when we talk about aerobic exercise, we're talking about those things that don't involve weights. It's the one that's going to get your heart rate going a little bit more, so you can think walking, jogging, swimming, cycling, dancing. Those are all things that are going to be aerobic. So when we're doing aerobic exercise, you really want to shoot for 3 to 5 days per week. But if we go back to what I said a few slides ago, 3 days is going to be where you're going to want to start. And then after you do 3 days a week for about a month or two, and you're starting to feel like you can do that with not too many problems, and it's starting to get a little bit easier, then you can progress to 4 days a week and 5 days a week. Okay. Then moving to the strength section, that's going to be when you're using weights or machines in a gym, or resistance bands, or even body weight stuff. So if you don't have equipment, you could do chair sit to stand, which is where you just sit in a chair and then stand up, sit back down in the chair, stand back up, and try and do it as many times as you can. So that you're going to aim for 2 to 3 days a week. And the reason it's less than aerobic is because when you're doing those strength exercises and you're putting that load on your muscles, you need to give them a little bit more time to recover between sessions. So every other day with strength exercise is a good parameter to follow. And then when we talk about flexibility, this is how stretchy your muscles are. So can you touch your toes? Can you reach overhead? Can you bend side to side? This one, they recommend 2 to 3 days a week, but I think daily is actually most effective, because as we've seen, most people have some sort of issue maybe with their lower back, or their legs feel tight, their calves feel tight. The more you stretch, the better. One of the principles that I follow is a little bit often as possible with stretching. Okay, so it doesn't have to be a big part of your day, but if you do a 15 to 30 second stretch here and there throughout your day, it'll build up and make you feel better. Okay, so going into the intensity portion, this part is really important. For aerobic, we're looking for moderate intensity exercise, and then after that you'll see RPE is 12 to 13 max. RPE stands for rating of perceived exertion. It's a scale that we use in exercise physiology that's 6 to 20, so 12 to 13 would be kind of right in the middle. Another way you can think of it is on a scale of 1 to 10, you want it to be around a 4 or a 5. So if you were going for a walk and about 15 minutes in, I asked you how hard it was on a scale of 1 to 10, I would be looking for a 4 to 5. A 6 is okay too, but if you're at a 6 for too long, you need to start to pull it back a little bit, because doing the exercise for longer at a lower intensity can sometimes be more beneficial than doing a very intense exercise for a shorter amount of time. Okay, so start slow on that one, and then you can build up to that 4 to 5. With the strength stuff, you want to start with low resistance. Okay, so think about body weight. Start with very light dumbbells, maybe 2 to 3 pounds. You want to pick a weight that you can do 8 to 12 repetitions of an exercise with. And that one you really want to progress slowly, especially depending on the type of surgery you had. I'm going to use breast cancer as an example because that's who I've worked with the most. You want to be slow with the progressions because there is a risk for lymphedema, which is a swelling in the arm that happens after you've had like a major surgery or radiation. So you need to give the body time to adapt. So start slow, progress even slower. And then when you get to flexibility, you just want to move through the maximum range of motion as you can. So when you do a stretch, say you're trying to touch your toes, you do want to feel a little bit of resistance in that the back of your leg, and just hold that position. Don't force through it, because that's how you're going to end up pulling a muscle. So nice and slow, ease into the stretch, and make sure you don't hold your breath while you're stretching. Time. For aerobic, you're aiming for about 75 minutes a week to start. If you're doing more intense exercise, so if you're going above the 12 to 13 on that RPE scale, then your minutes are going to be lower. If you were to do maybe like an 8 to 10 on that RPE scale, or if we're using the 1 to 10 scale, it'd be closer to a 2 or a 3, then you can push those minutes a little bit higher. So think about it as the more intense the exercise, the less time you're going to do it, and the less intense the exercise, the more time you're going to do it. For strength, you want to do at least one set of each exercise, and you're aiming for 8 to 12 repetitions. What I do for the people in our program is we pick 6 exercises that cover the whole body. So we'll do some upper body, some lower body, some ab exercises. So we do about 6 exercises in total. If someone's just starting out, we'll do those 6 exercises one time through, 8 to 12 reps of each, and then they'll be done. If they've been exercising for a little while, then we'll do a second or a third set of the exercise, keeping those repetitions the same. And then for time and flexibility, holding a stretch for about 10 to 30 seconds is sufficient. And then type. For aerobic, you want something that you can do for a prolonged amount of time, large muscle group activities, so walking, cycling, swimming. So getting those big muscles involved, like your leg muscles, or if you're swimming, your back muscles, you're going to get a little bit more out of that if you can get those bigger muscle groups involved. And then for strength, you can use free weights. So free weights include dumbbells and barbells. Machines at the gym are really nice because they keep you in a good range of motion and they're very safe. Body weight exercises are efficient. So push-ups, sit to stand, calf raises, which is going up on your toes, are really good. And resistance bands are very cheap and you can even travel with them. So if you're going on vacation, you can keep up with your exercise. And then flexibility, static stretching. So static stretching is simply, again, I'm going to use touching your toes. So you go down to touch your toes, you go as far down as you can, and you're just going to hold it at that position for 10 to 30 seconds. You don't want to bounce up and down, and you don't have to continually go through the whole range of motion. So you don't want to touch your toes and stand up, touch your toes and stand up. You want to stay there for about 10 to 30 seconds. And you want to do total body stretching, but you also want to address the specific areas that were affected by your treatment. So if you have some underarm tightness following a mastectomy, you might want to work on stretching those underarm muscles. So a couple quick stories from Get Real and Heal that I can share with you from kind of 2 different perspectives. So the story of Pam, when Pam came to Get Real and Heal, she was in a wheelchair. And we did some exercises with her. We would move her onto a recumbent bike, which is just a bike where you're sitting back in a chair. We would do the bike for about 10 to 20 minutes. We'd move her back to her wheelchair, and we'd do some exercises sitting down. So we did that for a few weeks, and about 3 months into the program, Pam came back, and she came in through the front door, and she was walking with a cane. And it was kind of surprising because I didn't know that she was working toward that. And about a couple months after that, when I was working another job on top of Get Real and Heal, I was out in rural North Carolina, and I stopped by this little hair salon that I knew Pam worked at, and I went in, and she was standing up, no cane, sweeping all the hair off the floor, and she had been on her feet all day with no problems. Okay, so it shows you that wherever you are, the exercise can meet you there and help you get to where you want to be. And then we have the story of Allison, which she started a little bit further along than Pam. So Allison was a walker. She walked her dog every morning. And when she came into our program, she was a part of a study. And we started getting her into more intense walking. And then from more intense walking, we got into short jogs. And then from short jogs, we got into long jogs. And now Allison is actually planning to run a really popular race in this area called the Tar Heel 10 Miler next April. And she's training right now. She did her first 5-mile run, and I will probably be running it with her next April. So it's kind of, I just wanted to give you those 2 examples so you can see that, like, no matter where you're starting, this exercise can get you to your goal. A little bit about Get Real and Heal, which is the program that I work at. So Get Real and Heal, it's a 16-week exercise program. So when you come in, we go over all the medical history and doctor's clearance that we talked about. We do a graded exercise test, which is just about a 12 to 15 minute test on a treadmill, just to see what your capacity for exercise is. After that, we train for 16 weeks. We're doing aerobic exercise, strength exercise, and flexibility. And then at the end of those 16 weeks, we retest you to see where you improved. The good thing about Get Real and Heal is while it is a 16-week exercise program, those 16 weeks only mark from where we do your initial assessment and your final assessment. After that, you are free to keep coming to the program and using Get Real and Heal as your gym. We have one-on-one individual programming, and we do have some small group things, but nobody's ever doing the same thing because, as I said at the beginning, it's really important to tailor the exercise to each individual person. We focus on aerobic strength and flexibility, but quality of life is the aim. We're not there to train athletes. We want people to get control back of their life, and we want them to be happy, and we want them to be safe, and we want them to feel good and be healthy. So no matter what, we will help you try and reach your goals, but the bottom line is just quality of life. And the other thing about our program is that you get to meet others with the same story. So you have some people who come into the program and they're 2 weeks out of treatment, and they get to see what someone who's 5 years or even 8 years in some cases out of treatment and how they're doing. And it's nice to see what can happen 8 years from there. And then you also have someone who's been through all of this that's kind of guiding you through the entire process. And everyone in that building knows what it's like when you have to go for your 6-month and 1-year follow-up. So it's kind of this groupthink mentality where we help each other out as they're going through those things. So like I said, we do some pre and post testing. We're trying to improve how you feel on a daily basis. That is the goal. We want you to leave our building each day feeling better than when you came in. And we really want to improve your strength and power so that when you're at home, you can do these, what we call activities of daily living with minimal problems. So activities of daily living can be mowing the yard, putting dishes in the cabinet overhead and being able to do it without pain, playing with kids, or whatever you need in your life to be happy. So some quick tips for making changes. Remember, a little bit goes a long way. Even if you're thinking of exercise as just breaking up prolonged bouts of sitting. Try and get up every hour for a few minutes and don't sit for too long. Try and drink a little bit more water. It's a good way to start forming a habit. Start your day with a walk. If you start with exercise, it kind of sets the precedent for the day. It'll help with better sleep, but you also need to focus on trying to get better sleep because that'll make you feel better and decrease some of your fatigue. And then remember that you can take a break when you need to. There's no shame in taking a rest day if you're not up for exercise that day. So I always remind people, exercise is important, but listening to your body and taking breaks is more important. Here's a quick little sample week of what some of our participants do. So on Sundays, we might just go for a leisurely walk for 30 minutes. On Monday, they'll do a 30-minute walk plus 15 minutes of strength exercises. Tuesday, another 30-minute walk, and you'll notice that we're not doing strength exercises in consecutive days. Wednesday, we go back to 30 minutes and 15 minutes of strength. Thursday, maybe take a rest day, but rest day doesn't mean just sit on the couch, so you want to get up and move around a little bit. Friday, another 30-minute walk, and then Saturday, a walk for 30 minutes and 15 minutes of strength. And remember, you can replace walk with jog, swim, hike, dance, okay? So keep the variety. You don't want to get bored and you don't want to get complacent. You want to keep yourself entertained. Give yourself some rest days, and remember just to do what you can. If you only have about 20 minutes for exercise that day, do those 20 minutes because something is better than nothing. And then some tips for adding exercise into your life. Park at the back of the parking lot when you go to the store. Get those extra steps in as you get in and out. Try and take the stairs instead of the elevator. Even if you're working on the 6th floor, see if you can take the elevator to the 4th floor and then take the last 2 flights of stairs up. Get up and move at least once per hour. And even if 10 minutes of movement can go a long way. So when we're shooting for 30 minutes of exercise for a day in terms of walking, even if you can do 10 minutes in the morning, 10 minutes at lunch, and 10 minutes at dinner, those do still have a really positive effect on your body. So use those times to get up and move. And then quick summary, we're shooting for 75 to 150 minutes a week of moderate intensity exercise. Remember to get those doctor's clearance notes and just let your doctor know that you're planning to exercise. Take your time. Remember that this is a marathon, not a sprint. You're going to have to start slow and progress slower. And please just be safe, okay? You got to look out for yourself. And if you're working with a trainer, make sure they know how you're feeling all the time. And that's it. Thank you.
Awesome. Thank you so much, DJ. We are now going to take some questions from the audience, and we've had a couple come in. The first question is about ports, and she asks, are there any exercise restrictions that you know of if you have a port for chemotherapy?
So we do have people in our program who have gone through breast cancer treatment who do still exercise with the ports. What we really try and do is not go too heavy on chest exercises. So if we're doing push-ups instead of doing push-ups on the ground, we'll do push-ups on the wall, or maybe we'll do chest presses with a light band. I haven't heard too many people complain about pain or restriction when doing that with a port, but it is, like I said, everything else, it's completely individualized. So if you feel pain in a certain movement, if you're doing exercise with a port, just try to avoid that movement. You can still get great exercise focusing on lower body and arms and back exercises, but you don't force any exercises that you're feeling pain with. But as far as I know, it is completely safe to exercise with a port in, because we still have a lot of people who do it.
Great. Another question, and I think you touched on this a little bit, is for the 30 minutes that you're recommending, does it have to be all at once?
No. So 30 minutes is great if you can do it all at once, but like I was saying at the end, you can break it up into smaller bouts, but with those smaller bouts, if you could get them to be at least 10 minutes long. So you can have a cumulative effect of exercise, but you don't want to do like a minute here and a minute there and a minute here. Try and get those bouts to be broken up into at least 10 minutes. So we always tell people maybe a 10-minute walk after breakfast, a 10-minute walk after lunch, and a 10-minute walk after dinner, and you'll have that same effect of 30 minutes.
That's great. Thank you. Another one I'm sure a lot of us can relate to is I've never exercised before and I'm feeling extremely embarrassed. How do you suggest I move forward?
I think if you have the resources, if you have internet at your house, there's actually a lot of really good videos on the internet, like YouTube, where you can find ways to work out at home in your own living room with nobody watching you. I feel the same way when I go to a gym. I wish I had like my own private gym. I don't like people seeing me. But if you have access to the internet at home, that's a really good way to do it, because you can find, not only is it at home and private, but a lot of those videos you need very minimal equipment, if any, to do the workouts. The other thing I can tell you, if you are going out into a gym, is working one-on-one with a trainer can really help, because they're going to make sure that you're doing everything correctly in terms of form and using the machines correctly. If you're going to a corporate gym, they usually have trainers that are on the floor there that are there to assist you in using the machine. So if you ever are interested in using a machine but you have no idea how to get on it and how to use it, ask one of those people on the floor, and they're there to guide you through it. And then hopefully that can save some of the embarrassment, because they'll show you exactly how to do it.
Yeah, that's great. And this might circle into the next question, which is I live in an area that is a little bit more rural and don't have access to a local gym. What suggestions would you have for me? Okay.
Well, again, I'll say the same thing about trying to use YouTube if you have access to the internet. But if not, getting out and going for a walk every day is one of the best things you can do. Not only is it good for your heart, it's actually really good for your bones too, because that little bit of impact you get through striking the ground is really good to build up your bones. And a lot of times when you've gone through cancer treatment, some of those drugs affect your bone density. So it's good to get out there and do something like that. But if you don't have access to resistance bands or the internet, so you can't figure out how to do certain strength exercises, just go out and walk for as long as you can. If you can build up to an hour-long walk, that would be really great.
Wonderful. Okay. Thank you for your great questions. I think that was helpful for all of us. So DJ is our speaker this month, but next month we're going to have a nurse practitioner. She's going to talk about prostate cancer screening. September is Prostate Cancer Awareness Month, and she's going to be talking about prostate cancer screening specifically and some of the controversy that surrounds it. So please join us back here on Friday, September 27th. That'll be again at noon. And if you have any further questions for DJ, I'm sure he'd be willing to entertain them.
Absolutely.
Feel free to email us at the address on your screen. So thank you so much, DJ. This was wonderful.
Thank you.
And thank you all for tuning in today.